let's talk about what it looks like to be a successful surgical trainee. And this is probably more aligned to what you can be doing to prepare yourselves in doing surgical training or being selected for surgical training. So think about a surgical registrar you've seen who you think is actually a good person or successful, being successful in their surgical training, doing really well. What sort of qualities come out in that particular person to you?
In my experience, whenever you've looked up to someone who's a registrar and had the impression that they're successful, I tend to find a common thread is that they're good teachers.
Yep.
They tend to be able to teach to a wider demographic and then pitch things at appropriate levels, which I think invariably confers the fact that they understand the content a lot themselves, but it's also an additive skill to be able to teach.
Yep.
I think that ability also allows the clinician to engage and inform consent a lot better as well with patients, to be able to pitch things and teach them through the process how that might look and that sort of thing.
Right. Yeah. So that's a really good observation. I can't argue against that. You said that your sort of model registrar, someone who's really good, is knowledgeable. They actually are good at communicating, not just to their patients but to the colleagues around them. But I think the other thing about someone who really wants to teach and takes the initiative to teach, they actually show an interest in people around them, and they actually have an awareness and empathy that people at your level actually want to learn, okay? That they want to learn, they want to enrich themselves, all of that, and they're there to actually impart that, okay? So it's a little bit of a selfless act, because when you see how busy registrars are, they don't actually have to take time out, okay? Of course, they get points for teaching these days, so that helps. If you're trying to get into surgical training, one of your surgical RMO wants to teach you, that's partly because they get points for that. It's always good to motivate them. What other qualities would strike you? Yeah.
So being hardworking and diligent is
very
important.
Yeah.
So make sure you have quite an attention to detail and make sure that everything is done as it should be.
Yep.
As well, the other thing I think is quite important is being a team player. So making sure you share the teamwork amongst the other registrars and juniors, and I think that gains a lot of respect as well within the team and just overall functioning of the team.
Yeah. Okay, so again, a few things there to unpack. Hard working. Now, when someone says, "Oh, I'm hard working," they're going for one of our jobs, and they go, "Oh, we're really hard working." We have to ask them, what do you mean by hard working? You've said they're diligent, the attention to detail. That's really important. There's a lot of information that you go through when you're assessing a patient, you're managing a patient, and then you multiply that by 20 or 30 or 40. So that's how many patients you may have. Maybe 40 is pretty high, but it does happen. So you have your group of patients that you're looking after, and you've got to pay attention to that detail, because some detail is really critical. You miss that information, you don't communicate that, you don't get a good outcome sometimes. So attention to detail, diligent, actually chasing things up. What else do you mean by hardworking?
I think always putting in your best effort to make sure all your tasks are done, and I think it goes back to checking over things and just putting in a lot of effort and not taking an easy way out.
So it's really been having a work ethos that says, I have responsibilities and other people are relying on me, and part of those responsibilities is not just doing my job well, but making sure that all the things that determine that it's a well done job is actually completed. So it's accurately done, it's done in a timely way, it's done with good humour, so you're not grumpy about it, you just get on and do it, you focus on it. And then the other thing you said is a good team player. What do you mean by a good team player?
I think from a senior, from a registrar or fellow, someone who's approachable, goes in with what Brandon said about teaching as well.
Yeah.
And yeah, sharing the workload evenly, not leaving the jobs that are less desirable to someone else, and making sure that you do that.
Yeah. And when you become interns, you'll work with a whole lot of different colleagues, and you'll soon get to know which colleagues are really good as team players, because they're there. First of all, they take on the tasks that they've been delegated, and then they look out for you. They actually say, oh, look, you look pretty busy. I've just finished mine. What can I do for you? Okay. And the really good ones are the ones who will anticipate. They'll go, oh, it looks like this XYZ is going to happen this afternoon, so let's do this in the morning to try to then allow XYZ to occur, or whatever. So there's a lot of anticipation. So they're generally very good at managing their workload. We sometimes just call it time management, but it's really managing the workload, good at doing what they need to do, and also helping out with others, okay? Giving your colleague a really good, being supportive and helping out when you can. Okay, and the other thing which you haven't mentioned, but again, really important, is having someone who knows their limits, okay? So what you're trying to do is to say, I'm trying to impress the people who are around me so that they can give me a good reference. So I don't want them to see too many of my weaknesses. But at the same time, you have to be pretty careful about it, because if you're overconfident and if you don't ask for help when you need to ask for help, you will come unstuck. And the problem is, when you come unstuck, potentially a patient is suffering, okay? So be aware of that. And so the good junior doctors who we see are the ones who actually perform well, but they also know their limitations, and then they have a very low threshold to call for help. And so when I work with a registrar or an intern even, I get the sense of how much I can trust them, and I guess we haven't mentioned it, but trustworthiness. And it's built on, if I say something, I can rely on them to follow it through, but I also know that at a certain stage they will come and speak to me if they're not quite sure what's happened, or they'll say, I did do this, but I made a mistake, or something didn't get done, or I forgot to do something, because we all forget things, okay? So that's really important.